chiropractor. Today I'm here to introduce to you guys what happens in a chiropractic session. There are a lot to do during the first visit. Upon patient's arrival, vital signs such as blood pressure, weight, height, and consent are taken. Next, during history taking, multiple questions regarding of the complaint will be asked. Besides, patient's psychosocial history, family history, and system reviews will be asked too. This is to gauge patient's general health and active daily living that may relate to the problem. After history taking, a detailed physical examination will be carried out, which consists of postural assessment, range of motion, static and motion palpation, neurological assessment, and orthopedic tests. These steps are there to help chiropractors to spot the anatomical structures that are responsible for patient's complaint. After physical examination, further imaging such as X-ray, MRI, or blood tests may be ordered. Once everything is done, an explanation of patient's complaint is given together with patient's prognosis and a detailed treatment plan. The treatment plan may consist of a few elements. For example, chiropractic adjustment, modalities such as ultrasound and shockwave therapy, home exercises, nutritional advice, and soft tissue therapy.
So good evening, everyone. Welcome to our third day of ACM World Spine Day 2021 webinar, Fitness and Wellness Program in store for you all. The World Spine Day 2021 Virtual Challenge is happening now until 16 October 2021. Join now and finish the challenge for a chance to win amazing prizes. This World Spine Day let us all commit to being kind to our spine, reactive, and get back to back. How to join? Download the BookDoc app either from your Apple App Store or Google Play Store. Register an account, sync your fitness tracker, verify your phone number, and join the virtual challenge for free or paid entry. Today's session is brought to you by the Association of Chiropractic Malaysia and sponsored by Evo Performance. Today's topic is post-COVID recovery rehab exercise, and our special guest is from BENPHYSIO and Rehab, Ben Loo. He is the founder and director of BENPHYSIO and Rehab. He is certified in physiotherapy and graduate from UKM in 2008. He volunteered in NASAM in 2008 and currently volunteering in Tzu Chi Neurological Stroke Support Group at Purdue as a chief physiotherapist. If you have any question for the webinar, feel free to drop your question in the comment box and we are going to address it at the end of the session. Let's welcome Ben Loo.
Hey, hi Yikai. Thank you very much, Yikai, for the introduction. Okay, so hi everyone. Welcome to this sessions COVID-19 rehabilitation by physiotherapists. So I think COVID-19 has been hindering everyone for the last 2 years since 2020. So hopefully by 2021, 2022, we will have a better year. Okay, so okay, before I start, okay, let me introduce myself. So actually, I'm a physiotherapist. So I own or I run a physiotherapy center, private physiotherapy center in Klang Valley, and it's my honor to join this chiropractic associations organizing. okay, and to share. Actually, from there you can see that actually we work hand in hand. All right, so physiotherapists is not only treating spine cases, joint cases, we also treat in COVID patients. Okay, so therefore after this, the slides were showing everyone, okay, what is the role of a physiotherapist, okay, in a COVID-19. Okay, so there's a QR code up there. So if you want to know more about us or about our services, okay, you can scan the QR. I think the next few slides, at the end of the slides also, we have the QR code as well. Okay, next. Okay, so yeah, so actually last month was a World Physiotherapy Month. Okay, so on 9th September, it was a World Physiotherapy Day. All right, physiotherapy, we emphasize a lot of movements because we believe when there's movements, there is health. All right, so if you're bedridden or you are a very sedentary lifestyle, come on, move on. Okay, move. All right, get out from the chair, move, because movement brings us health. All right, not only from the physical, which is the muscles, the joints, also bring health to the neuro, which is the brain. All right, our nervous system. You also bring health to the balance, okay, coordination. And last, the most important is if you do not move, okay, our heart and lungs will deteriorate. So therefore, movement is so important so that we can keep our heart and lungs healthiness. Okay. Yeah. So let's move. Okay, let's move. I believe yesterday there was a Zumba class. Okay. So it's a good one. All right. So what is COVID-19 rehabilitation? So basically, science-based treatment by physiotherapists as well as medical teams, okay, either in hospital based or non-hospital based, to provide to a COVID patient. All right. If you are in contracted with COVID-19, of course, the treatment will be more, we call it acute treatment. All right. Now, after you are recovered from COVID-19, we call it a post-COVID rehabilitation. All right. Because everyone knows, we do not know in the beginning, okay? But as the times pass by, we know that COVID-19 do bring us a long-term impairment. All right, I repeat, COVID-19 do bring us a long-term impairment, or another word, we call it long COVID syndrome. Long COVID syndrome. Also, everyone can Google long COVID, so you can get some information from there as well. And this impairment will lead to some disability. So therefore, today as a physiotherapist, I'm coming in to guide you all or to give you some advice on what are the disabilities that we can look into. Okay, next. Okay, so rehabilitation is defined as a set of intervention, all right, which will mean it's a very comprehensive intervention to reduce your disabilities, to reduce your and to optimize your function. Okay, we know. Okay, that's why today we're going to talk about 6 aspects post-COVID. Okay, 6 aspects that affect our by the COVID, and from these 6 aspects, how are we going to reduce the disability, and how are we going to optimize the function? All right. So rehabilitation is part of the medical care and is a problem-solving process. We solve the problem. You come in, you have these problems. We solve the problem. We use evidence to solve your problem. We diagnose your problem. Okay. So this is what we call rehabilitation. Okay. Now today we'll talk about rehabilitation by physiotherapists. Okay. So now, touch wood. Okay. If you are contracted with COVID-19, next. If you are contracted with COVID-19, category 3, category 4, okay, that's where you will see us the most common in ICU. Next, please. Okay, in ICU. Okay, ICU is not the software where we chat each other. ICU is in an intensive care unit. So all the 3 pictures are showing that the physiotherapists and also the nurses as well as the medical teams are helping the patients to recover from COVID-19. Right, because as you said, COVID-19 will bring you impairment. It can be anything: your balance, your movements, your coordination, your mobility, even your respiratory. All right, so therefore, physiotherapists will enter your ICU room, okay, to help you to recover, to maximize your function. Okay, so next. And the most common pictures that nowadays people see is these pictures. You'll be wondering, how come all the patients are facing downward? What, is it so comfortable in the ICU there? Okay, so answer is no. Okay, but we found that, evidence found that this is the most comfortable position for the lungs. Okay, When we say most comfortable position means because of the we call it VQ match. Okay, we are trying to ventilate the lungs as much as possible by positioning the patients. All right, and research found that this position facing down, or we call it prone lying, is the best position to maximize the ventilation of the lung. Because we know after COVID, lungs scarred. Okay, they become scarred. There are a lot of fibrosis, scarring inside our lungs. All right, and this position maximize the ventilation of the scarred lungs. All right, so therefore in ICU, you can see there are many of patients, they are lying in this position. Okay, so next, and of course, if you're intubated, same thing. All right, now pictures on the left, you can see is there are so many medical teams, okay, trying to turn the position into facing downward. All right, and on the right hand side, the picture on the right hand side with a lady holding a red color band. Okay, the red color band, we call it exercise band or resisting band. Okay, and today we have our sponsor, it's a Evoband. Okay, the brand called Evoband, EVO. All right, now when in ICU, when you want to gain your strength, okay, your upper limb strength, your lower limb strength, even your trunk strength, okay, we will bring this very affordable, very handy exercise equipment into your ICU or into your rooms and do exercise with you. All right, it will strengthen all your muscles that we want to. Okay, next. Okay, so after we're talking so much, okay, of course, okay, what is the benefits of having rehabilitation after COVID? Okay, we have to optimize your health because we know from 6 aspects what are you losing, and then therefore from these 6 aspects we try to maximize, okay, to maximize your health as well as your function. All right, next. And second benefits is of course the best, early discharge facilitation or early discharge program. All right, we don't want to stay too long in the hospital. All right, hospital is the most dangerous place now for these 2 years. All right, because there are so much of COVID virus around which you and I cannot see. So hospital is the very dangerous place. All right, so therefore we want to get you out from the bed, we want to get you out from your room as soon as possible. So therefore when you have early rehabilitation in the COVID, that's why I say when we say early, doesn't mean that when you discharge. Early means as early as when you're in ICU. Okay, even though you're in coma status, we still can do physio for you. So when you start to pick up your consciousness, we start to do physio for you. Okay, we move you. Even with all the tips around you, we move you up. Okay, so because why? We are heading towards early discharge. Okay, the earlier you discharge, the earlier you get out from the dangerous place, the earlier you are better. Okay, next. Okay, so generally in rehabilitation consideration, so we are looking into few things. Okay, now number one is the temperature, the saturation oxygen. All right, now I think oximeter has become the very popular word. Okay, I repeat, I believe oximeter has become the most popular words nowadays. All right, you Google, you Shopee, you Lazada, you can see oximeter. Why? Because we use oximeter to measure our oxygen level, of course. Okay, so oxygen level, everyone should know what is the minimum percentage. Okay, we should have 95% and above. Okay, so there's a saturated oxygen. All right, now of course cough, dyspnea. We also another rehabilitation is we also try to wean off your oximeter, oxygen therapy. Wean off means what? We will try to remove your oxygen supply and see whether your oxygen drops. So when your oxygen drops, we put back your oxygen. If your oxygen doesn't drop and you can maintain it well, so we will slowly reduce your dependence on the oxygen supply. Because why? We have air. Okay, air is sufficient already, the oxygen. So we don't want you to over depending on the oxygen supply. Okay, so then we have reconditioning. We have peripheral muscular strength. Okay, we will check out your strength. Okay, now if you know those who stay in ICU, if you're lucky enough, 5 days you get discharged. All right, if you're not lucky enough, you can be in ICU for 1 month, 5 weeks. Okay, now what happens when you are lying down? When you're lying down on the bed without movement, you lost all your muscles. Okay, to gain your muscle, you need 3 weeks, 21 days, ma. All right, to gain your muscles, you need 3 weeks. To lose your muscle, you just need 3 days. 3 days in the ICU, trust me, you will lost your muscle mass already. Okay, that's where physio comes in to help you to regain your strength. Okay, of course, one of the way is by using exercise with resistant band, Evoband. All right, next, okay, we also will exercise with sorry, not next it. Okay, so we also exercise with a gradual load increase. Okay, nowadays we also do something called telehealth or online health consultation. We also do COVID consultations or via online. Okay, world has changed. Okay, online internet has become so important, so that's where we come in as well. Okay, online consultation to coach our patients, COVID patients, how to do exercise in front of us, okay, in front of the screen. And then lastly, also we will check out your balance. Okay, we'll review your balance, because why? Poor balance will lead to fall. When there's a fall, there's more problem. Fracture in the spine, fracture in the arm, fracture in the pelvis. Okay, so before we really discharge you, make sure that you're walking normal. We will assess your balance. Okay, part of the neurological. All right, next. Okay, 6 things. Okay, this is the main topic today. 6 things that we're going to assess for COVID patients. Okay, number 1, oxygen. Number 2, maximum heart rate. You need to know how to count your heart rate. Number 3, spirometer. All right. Number 4, 6-minute walking test. Okay, either with or without oxygen, because some people may discharge from hospital using oxygen tank. All right, a portable one, not a big one, a portable one. All right. Number 5, BOCH scale. Okay, it's a scale to evaluate ourselves. And lastly, our strength testing. Okay, so we have 6 things or 6 aspects to assess our COVID patients. Okay, the main aspects are, okay, so we'll go through one by one. So there's a QR code on the right corner. All right, there's a QR code to lead you to our slides today. Okay, if you want to get our slides today, you can go to the QR code. You can scan the QR code. All right, next. Okay, before I start with the first important one right now, the very, very, very important or most vital is that respiratory rehabilitation or post-COVID rehabilitation is not recommended right after you discharge from the hospital. Okay, so it is not, I repeat, respiratory rehabilitation or COVID rehabilitation is not recommended right after you discharge from hospital. All right, the reason is because you have to let your lungs, okay, heart to settle down first after intubated so long. All right, so normally what we do is within the first 2 weeks, okay, we will let you have a break, and then that's where we come in. Or maybe before you discharge, your physio will come in and teach you some simple breathing exercise. Okay, because we don't want to teach you the diaphragmatic breathing, persistent breathing, or whatever exercise, which will strain your lungs and heart. Okay, they need some rest as well. Okay, so therefore, always remember, do not too enthusiastic, okay, to do your respiratory rehab after COVID. Especially you just recover from breathless. Now you put someone into breathing exercise again. You are creating problem. You are creating hyperventilation. You are creating drop in the oxygen. Okay, so always consult with the physiotherapist. Okay, if is it good timing to start with the respiratory rehab? Respiratory means lungs rehabilitation. Okay, so next. Okay, first thing that we need to check, oximeter. Okay, saturation oxygen. So quick question. Everyone know what is a normal oxygen level in the body? Okay, does everyone know what is a normal oxygen value in the body? Okay, so we go by percentage. Okay, the normal one is 95% and above, up to 99%. Some people will tell me how to pump into 100%. Sorry, sometimes you may not able to pump into 100%. Okay, 99 is good enough, 97 is good enough, no worry. Of course, after exercise, you may go slightly higher, 98, 99 than normal. All right, so and this is our saturation oxygen. Now, there's one category, not COVID, there's one category of non-COVID patients will have lower oxygen. Okay, this category we call it COPD. Okay, chronic obstructive pulmonary disease. Okay, for example, asthmatic, cystic fibrosis patient. All right, otherwise, if you're a normal people and if you're a normal human, you should have more than 95%. All right, so this is the first thing you need to check. Okay, today you may not have spike in your temperature anymore. I repeat, today you may not have spike in your temperature anymore, but oxygen will tell you if you are a COVID patient or not, besides the RTK antigen test. Okay, so oximeter, very important. All right, so I wish everyone at home, you should have one oximeter to check out. Okay, besides RTK test. Yeah, especially if you those already contracted with oximeter, it's always good to have one to check your saturation. If you find that your saturation has dropped to 90%, 88%, Don't say, don't worry lah, okay, 88 only ma, 7% difference from the 95 standard. Okay, I just need to deep breathing a bit, few more times, it will pick up again. No such thing. Okay, once it drops 88%, 87%, 86%, please fly to hospital. Okay, please fly to hospital. Okay, because you are considering under category 2 or 3 already. Okay, do not go in too late. All right, always receive the treatment as early as you can afford. All right, and nowadays hospitals are less occupied. Okay, we have more rooms, we have more space to recruit category 3 COVID patients. Do enter hospitals. Okay, do not hesitate. Do not hesitate when your oxygen drops below 95%. Okay, unless you are a COPD patient. All right, so next, the second thing that we're going to assess is your heart rate. Okay, now over here I give a formula over there. Okay, maximum heart rate means 100%. Okay, you use your age. Okay, 220 minus your age. 220 minus your age. Let's say my age is 40. Let's say I'm not 40 yet. So my age is 40. So 220 minus 80. Minus 40. So it's 180. Okay, so 180 is my maximum heart rate. That means what? If you do any exercise for age of 40, any exercise, your heart rate should not reach 100%, which is 180 beat per minute. Okay, I repeat. So if you are doing your exercise, age of 40, you're doing exercise, your heart rate should not exceed or should not reach 180 beat per minute. Okay, if it does, please stop your exercise. Okay, you're in trouble. Okay, you are asking for trouble. All right, now from this 180, so how do we count? Okay, so we don't want our heart to pump 100%. This is not a car. Okay, if I will push, okay, yes, I will push all the way 100% to see what is the maximum speed or velocity. But my heart, I never want to push it to 100%. Okay, so I will only consider it to 60%, 50%, or 80% based on your physiotherapist's justification on your condition. All right, now I give you an example. Let's say I'm 40, I'm very, very poor in the breathing, etc., etc. My physio says, okay, your heart rate, you can only go up to 60%. So I'll take 180 times 60%. So that means what? My heart rate should be 108 beat per minute maximum, 60%. Okay, 60%, 108 beat per minute. So that means what? When I go and do shopping, doing treadmill, bicycle, I always check my watch and then make sure that my heart rate is 108 beat per minute, not more than that. Because why? I want to keep my heart exercise at only 60% of 60% capacity. All right, so everyone, the formula is 220 minus your age. So if your age of 80, let's say, age of 80, so your maximum heart rate is 140. So of course, you don't want to reach 140 lah, okay, because your heart may kong very fast. All right, so we never want to push, and your heart is no longer push, okay? It's a normal human heart. You don't want to push too hard, okay? Maybe you push to 60. Then when you think you're okay, then only we increase some more. All right, always consult with your physiotherapist. They will know what is the value to give you. Okay, so next, so we have gone through oximeter, we have gone through this heart rate. Now the third thing is we call it a spirometer. Okay, the third thing. Okay, spirometer is something for you, is an apparatus like the picture. It's for you to suck in the air, okay, to increase or to expand your lungs. Lungs is like a balloon. If you don't use it or you don't use deep breathe it, it will keep on shrinking and shrinking. It's just a muscles, okay? So therefore, lungs is for us to expand it, okay, like a balloon. So we suck in air, we expand the lungs. All right, now for male and female, there's a little bit, okay, over the market, you can see there's a 3 balls, diaphragmatic, or even this spirometer. Their measurements are different. The 3 balls one normally is about 1,500 cc, okay, and this one spirometer is 2,500 cc or 4,000 cc. All right, now if you are a male, okay, your cc should be looking at 4,000 cc. All right, and for female, about 2,000 cc, 2,500 cc will do. So do not use the wrong one. So now the diaphragmatic one, which involve the 3 balls one, okay, so there's about 1,500 cc. Okay, better than nothing. All right, so I think you can get it easily, okay, in all the online platform anyway. Okay, so this spirometer is meant to expand our lungs capacity. Okay, lungs capacity, because COVID shrink our lungs. Okay, make our lungs scarring. So therefore, we need exercise to expand the lungs, expand and to scratch the lungs in so scars inside the lungs. Okay, so this is the third. And now number 4. Okay, number 4, 6-minute walking test. Now this is a very professional assessment tool. Okay, I repeat, this is a very, very professional, reliable, valid assessment tool to assess COVID patients. All right, basically, how does it work? So we look for a space, okay, a walking space of about 10 meter, sorry, 30 meter. Okay, of course, it can be shorter, can be longer, but there's a standard size, okay, which is 30 meter. Now, we make the patients walk around circular between these 30 meters. All right, and we see how many rounds these patients can walk within 6 minutes. All right, so some patients can walk, make it 10 rounds. Some patient can make it 5 rounds. So we just record it down. Because why? This is why we call it, we are assessing your exercise tolerance. How well your body, your lungs, and your heart to perform exercise. Okay, now if you are a patient with oxygen, Ben, so does it mean that I need to remove my oxygen and walk? And then when I have not enough oxygen, I stop and put back? No, you can walk with oxygen. Okay, and during this test, you can rest if you need a rest. Does not matter. Okay, this rest doesn't mean that you must finish it as quick as possible. This test is just to check your tolerance, how much you can walk within 6 minutes. That's all. Okay, so this is a very valuable, very reliable, very evidence-based, simple test that we can test at home. Okay, yeah. So this is the number 4 test that we will look into. Now, next, number 5. Okay, some patients will tell me, Ben, I don't have oximeter. Ben, I don't have heart rate meter. I can't measure my heart rate. But anyway, by the way, you should have oximeter lah, huh? Okay, so what else I can do to self-assess myself? Okay, never mind. Now I give you a scale. Okay, this scale, we name it Borg scale because it's designed by someone called Borg, B-O-R-G, Borg. Okay, based on this Borg scale, right, it started from 6 to 20. The value is 6 to 20. All right, now you look at the color. Green color means what? Green color means you are safe to do exercise. Yellow color, okay, you are either there or neither there. Okay, you can still continue with your exercise, or you want to give a pause to your exercise. Yellow zone. Okay, and the orange zone, or which is the red zone, we call it, you have to stop your exercise. All right, now this scale is a ruler, okay, for us to measure. Now when we do exercise, okay, let's say we are doing my 6-minute walk test exercise. I'm do halfway 3 minutes already. Now I ask myself, how am I feeling now? Okay, am I feeling terrible, or am I feeling I'm just very easy? Okay, or I'm feeling I'm moderately tired. Okay, so you have to rate yourself between 6 to 20. What is your score about your condition? Right, you can have you can say, I'm about 18, 19 now, over 20. Oh, that means you have to stop your exercise now. Okay, I think I'm still very leisure. I think I'm just about 6, 7. Okay, good. Let's continue with your exercise. Oh, it's a very, again, this is a very evidence-based assessments tool, okay, to self-test ourselves. Because sometimes we don't want to over-push our body. Okay, some people always say, listen to your body. Some people say, no push or no pain, no gain. All right, always remember, heart and lungs, okay? Heart and lungs is something that you cannot feel. Okay, you cannot feel. When they give you pain, you're almost at the edge of the red zone already. Okay, so Borg scale is a good scale for us to measure ourselves, the tiredness, the level of tiredness. If you feel tired, stop. If you feel, I think I'm okay, I'm still at the green zone, okay, score of 8 or 9, okay, proceed. Okay, when it comes to yellow zone, I think I still can push a bit more, okay, fine. If you think like, oh, I think I've done enough, red zone, all right, let's stop. Okay, so this is how you self-test yourself. Okay, so this is our number 5, okay, assessment, okay, for COVID patients, okay, in physiotherapy assessment. Okay, now next. So this is the program that I have in my center, okay, post-COVID telephysio. All right, so we also selling this something called COVID kit. So by having this COVID kit, we are sending out this COVID kit for our patients with oximeter, spirometer, exercise band, Evoband, exercise band, so that we can guide them for 10 sessions how to do the recovery at home, okay, via online and Zoom and internet. All right, so this is our program that we had since early last year. Sorry, since mid last year. Okay, next. Okay, last one. So as I said, you lost your muscle within 3 days. You build your muscles within 21 days, okay, 3 weeks. So if you are very touch wood, okay, you're contracted with COVID and you're in hospitalized for maybe, let's say, 5 days, 1 week, you definitely lost your muscle. Okay, so therefore, physios will come in to assess your strength, okay, to assess your strength. And then there's a simple way to assess your strength, grade 3, grade 2, out of grade 5. All right, and then that's where we will prescribe you some exercises to do. Of course, today via this webinar, I also will recommend some exercises, okay, to do, which include some breathing exercise, some legs exercise, and also some what I call it, arm exercise. Okay, so next, okay, we go into advertisement. Okay, so thank you Evoband for sponsoring me. Okay, thank you Evoband for sponsoring me. Okay, now why we are talking about this Evoband, because as I said, this is a very handy exercise tool. Okay, to strengthen your weak muscles. Okay, to strengthen your weak muscles. You can carry it anywhere. You can bring it into ICU. You can bring it to HTU. You can even bring it to toilet, your garden, your walkway, your golf course. Okay, to do your exercise. All right, and this Evoband, it comes with different colors. So different colors means different resistance. If you are very new, just recovered from COVID, you may want to look for a lighter color because lighter resistance. But when you're getting better, you may want to have a more tougher color or darker color because it's tougher resistance. All right, so this is how it works. All right, now Evoband have a very special things is okay. Next. So how we start with it? Okay, now we have different colors for different resistance. Okay, now number 2, okay, you can also do by holding, by holding few seconds, okay, to make your muscles more stronger. Okay, it can be start with 3 seconds, then slowly increase to 5 seconds, 7 seconds, whichever number you like. All right, excuse me. You also can do repetitions, more repetitions. Maybe the first week I just want to do for maybe 10 repetitions. Then second week I want to increase to 12 repetitions, 15 repetitions each time. All right, you can increase the repetition using this band because all this is meant to make your muscles stronger. All right, you can even double up your Evoband. What does it mean by double up? Buy 2. All right, actually don't need. Now the standard Evoband, it comes with 1.5 meter. Okay, the standard Evoband, it comes with 1.5 meter. It comes with a very what they call simple plastic 1.5 meter. So if you find that my color is too light for me already, it's too light already, so what I can do is I can double up, okay, and start to do the same thing. Okay, when I double up, still too light already, then you can triple up or triple up or four up, and then you do again. Okay, okay, so this is how you make use of the exercise band. All right, you can double up, triple up, four up, okay, six up. When you come to 6 up, please buy a new one. All right, you can change color. Yeah, number 5, change color. Because why? Yellow color is too loose for you already. It's a amateur level. Okay, you have to change to a more sophisticated level. All right, so and next, okay, so let's do some simple dancing. All right, so I think I have about 7 exercises over here. All right, now I'm recommending some 7 exercise, okay, so that we can do at home. Now this one we call it dancing exercise. I don't want to give a very complicated name because people won't remember. So I call it dancing exercise. So what do? My hand, okay, from my opposite hip to my same side. Okay, so yeah, if I'm using my right hand, I touch my left hip, I lift it up to my right side. Touch my left hip, lifting up to the right side. I call it dancing. All right, the direction we call it dancing. And with this dancing, okay, I can hold, one end is holding at the hip, all right, and then I pull it up. Okay, this is how we do it. Okay, so we call it dancing. Of course, you can do in different position. Okay, you can do in a first picture, which is a crawling position. You can do in standing position. I can do it in sitting position as well. All right, so we call it dancing exercise. This one is good for our shoulder and neck. Okay, so second one, this one is more important. We call it diaphragmatic. Okay, so now basically what we do is we want to make sure that you are using the correct muscles to breathe. okay, which is diaphragm. It's the biggest muscle in the body. So now when you are good enough in your diaphragmatic breathing, now next we can put in some resistance. Okay, just kidding, joking, you can put some stones on your chest, okay, to compress, and then you breathe against the stone, right? Okay, but this is not practical. As I say, just kidding, don't do this at home. Okay, so what we can do is we can get a rubber band, again the Evoband. All right, so hold over, okay, go over your lungs area, the last ribs area, okay, then you pull it, and then you breathe against the resistance of the Evoband. Okay, so this is how you strengthen your diaphragm as well. Okay, so this is the second one. All right, come third one. Okay, so third one, again, I name it as a shoulder blades muscles. Okay, if you want to have a nice posture, nowadays everyone work from home, so if you want to have a nice posture, now you can do like what is doing in front, inside the slides. So you tie your Evoband in one end, then you just pull it backward. Okay, as if you are trying to roll a boat. Okay, pull it backward as if you are trying to rolling a boat. Right, this one is meant to build all muscles behind your blade. The muscles behind your blade. Okay, so this one is strengthened. Again, just now we said you can have a different color. You can have hold for 3 seconds, hold for 5 seconds. You can have more repetitions, 5, 15, 20, 50, 100. Okay, or change the color, double up or change the color. Okay, there are a few ways for you to exercise your muscle. All right, then we have number 4. Before we proceed, number 4. Okay, some simple advertisement. Now, what is the best part about this Evoband? Okay, the best part is the number 1 snap preventive technology. Okay, that means what? Okay, they come to a circumstance, some scenario or circumstance that suddenly the exercise band will break. Okay, so Evoband comes with an anti-snap, okay, anti-snap technology, whereby it won't break like this. Okay, because when it break, right, you can injure yourself, especially if you are doing a high resistance exercise. Okay, so and again, what is the benefits? Okay, low powder, washable. You can wash this Evoband, you can wash, especially nowadays COVID. Okay, we need to keep it clean. Okay, clean from COVID. All right, then we have a different colors, non-sticky, reduced protein, right? Because we use more latex. Okay, and then less allergy. Some people allergy to some all this so-called rubber thing. All right, so less allergy and biodegradable. Okay, this one is biodegradable. Okay, it's not a plastic, which is not degradable. This is a latex type of. Okay, so it's eco-friendly, biodegradable. All right, so thank you for choosing Evoband. Okay, next. So exercise number 4, very important shoulder exercise. A lot of patients have a shoulder pain. All right, now one of the reason because one of the important shoulders are not working or not functioning anymore. Okay, that will lead to a frozen shoulder, shoulder impingement, unable to lift up. Okay, or when you're serving a ball, serving a golf, serving a tennis, you have the shoulder pain. All right, now this is a simple exercise whereby you tie a loop around your 2 arms. Okay, you tie a loop around your 2 arms. Okay, and then put your arms at the side, and then you just turn outward as is shown in the photo. Okay, this one is to build the shoulders in very important muscles. Okay, this one is more for shoulder prevention. Now, okay, I believe there are some patients who may have shoulder problems and will ask if this exercise suitable for him or her. Of course, you can feel free to ask us. Okay, you can scan the QR code. Sometimes some exercise may give you bad effect. All right, always consult your physiotherapist if you are suitable for this exercise or not. So I have to be careful. All right, now next. Okay, we also want to make our posture good. All right, posture muscles. So this is another posture muscle we call lower trapezius. Very important muscle. For those who always have a very hard muscles on top of the shoulder, this is the best exercise for yourself. All right, very simple. Tie the mid of the TheraBand or the Evoband at the top of the door or somewhere, hook. All right, then you are holding two ends of the Evoband and just pull it downward. All right, just now we are pulling backward like a rowing. This one is pulling downward, like trying to pull something downward. Okay, this one will build your muscles to stabilize your shoulder blade very well. Okay, so this is the 5th exercise which we can do with this Evoband. Okay, very useful. So you see, this is very handy, very useful. Of course, do not be too greedy that I think instead of keep on changing color, might as well I just buy the darkest color, black color. I tell you, you will kill your arms. Okay, so start with gradually. You can skip yellow color and go to red color, fine. All right, and then you go to blue color, then you go to the gray or the dark black color. Okay, so we have next soft arm muscle. Why I call it soft arm muscle? So everyone, you can see your hand, right? So this is the most soft arm muscles, okay? Soft arm, that's why I use the word soft arm so that you can remember. Okay, how to make this muscle stronger? Very simple. All right, so you hold like the lady inside there, okay, and then you just straighten your arm. Okay, you just try to straighten your arm in that position. Okay, because why? When you try to straighten your arm, actually you're trying to using this muscle, we call it triceps. Okay, or I call it soft arm muscle, the most lumbar muscle in the body. Yeah. All right, so this is the soft arm muscles exercise. All right, now you know already how to do it. Okay, you know already how to do it. Next is put on the resistance. Okay, 3 kilo, 3 kilo, different color, 3 seconds, hold for 5 seconds, hold for 10 seconds, or even different repetitions. Okay, so this is a soft arm muscles exercise. All right, next we have last one, we call it boxing exercise. Okay, boxing exercise is especially for guys huh? So they want to have a better shape. Okay, you want to have a better shape of your body. This is how you do. All right, so you hold the Evoband, okay, with the two ends with the two fists, and then you wrap it around your body. All right, now what you do? Boxing. So you just do a boxing, right, left side, left side. Okay, this one will strengthen your boxer muscle. Okay, your boxing muscle. Okay, so boxing muscle is important for our shoulder rehabilitation. Okay, so these are the few exercises that we can do with our limbs, upper limbs. Okay. All right. Of course, we also can use it for our lower limbs. Okay, but you can you can scan the QR code later also. Because I think we did not put it inside here anyway. Okay, so because lower limbs we need a demonstration. Okay, so you can scan the QR so that we can show you some few demo. Okay, on how to strengthen the lower limbs. Okay, so next. Okay, during this exercise, remember we were saying, okay, your oxygen starts to drop. Okay, during these exercises, your oxygen start to drop or your heart rate start to pick up. You start to catch with breathless. Okay, or you start to feel like, oh, but watch scale, okay, 6 to 20, I'm feeling 17, 18 already. Now, what you can do? Okay, you can, there are 5 pictures inside here. You can choose one and try your best to learn it. Okay, because self-proning at home, that means what? You try to find a position to let your lungs to expand the easiest way. All right, you can sit down, bend forward, or lean forward. Okay, or you can even sit down and lean against the table in front of you. Okay, or you can even standing and hold onto a stairs or hold onto the wall, lean against the wall forwardly, or you can even lean against the wall back or sideways. All right, so all this is a self-proning activities that you can ease off your discomfort, your breathless during this COVID exercise. Okay, worst come to worst, it still cannot make you catch up your breath. Go and lie down. Go and lie down at your side, or go even and lie down at your tummy. Okay, go and lie down at your side, or even go and lie down at the tummy. All this will help you to self-ventilate your lungs better so that you can catch up your breath again. Okay, so again, remember, when you exercise, do not work or do not move or do not exercise beyond your capacity, especially after COVID, because this COVID, the symptoms is too, it can be many symptoms. There are so many symptoms. Okay, so you have to be very careful. That's why we give we give at least 5 things for us to self-check. Okay, watch scale, oxygen, your heart rate, your tiredness level, or your 6-minute walk test. Okay, and yep, that's all my sharing today. And these are some reference. All right, if you want to know more, you can also Google long COVID. Okay, it will also give you some idea. And then my second last slide. Next, okay, there's a QR code here. So if you want to know more about us, then you can scan the QR code. Okay, so basically, in the physiotherapy, we call it is an art of rehabilitation. So we use science to diagnose you, evidence-based, okay, and we use heart to treat because every patient is different. So we try our best, okay, to treat you according to your problem. All right, and last, I think I have one more online webinar again this Saturday, I think somewhere in 10 o'clock, 10 or 10:30. Yeah. Okay. So it's about low back pain. Okay. So that's all from my side, Yikai.
Hi, Ben. Yeah.
Thank you. Thank you.
Thank you, Ben, for such a fruitful session, sharing all the informations. And please feel free to drop your question in the comment box. Then we'll go through some of the questions. Okay. So Ben, from the comment box, there's a few questions that I pick up.
Sure.
So there's one questions for you is that at least how many meter COVID patients should achieve before discharge? So just now you talk about 6-minute walk test, and so if there's you mentioned more towards a home check, but if the patient like want to discharge before after admitted in the hospital, is it possible to use this test? If yes, how fast should the patient able to walk, or an indication?
All right. Okay, very good question. Number one, this test you can do it anywhere. Okay. So the most important is we standardize what is the distance that you want to measure. Now, some people, their house is a bit too narrow, or the hospital may not have a 30-meter length for you to walk. So you can cut it half to 50 meters. So every time you just walk within the 50 meters and you time it at 6 minutes. Okay. Now, always as a physiotherapist, our instruction very important. This test is so reliable because they standardize all the instruction. How we give the instruction. We will not tell the patient, okay, sir, currently I give you 6 minutes, you try to walk as much as you can. No, this is not the instruction. This is a very wrong instruction. Okay, the instruction should be this way. Hi, sir, or Mr. Yikai. All right, now here there's a 50 meter or there's a 30 meter. Okay, so now I just need you to walk from point A to point B within your comfortable pace. All right, if you feel tired, feel free to sit down, because of course we will prepare some chair for them to sit down. So if you feel tired, you can sit down, you can stand there, whatever. As long as within 6 minutes, I just want to know how much you can walk. That's all. All right. Yeah, so this is how we do. So of course, before you discharge, if you have a chance to see a physio, they may do a 6-minute walk test with you as well. Yeah. Okay. So that you can have a baseline. Okay, before and after. Yep.
Okay. So thank you very much for the information. So there's another question. So what type of symptom persists in a patient with post acute COVID-19 syndrome?
Okay, this is a very very huge question. Okay, honestly, COVID-19 attacks multiple organs. Okay, multiple organs. Okay, that's why it also attacks the heart. Okay, pericarditis. It also affects the joints. Okay, it attacks any parts. Okay, of course, the biggest organ that they attack is the lungs. That's why the saturation has become so important. So if you ask me what is the prolonged symptoms after COVID, right, it really depends. Okay, some people breathless, some people have sleepless night. Okay, some people have high, what do you call it, tachypnea, which means the high fast breathing, or some have tachycardic fast pace of the heartbeat, or some people have loss of taste buds. Okay, some people lost it for 2 weeks, some people lost it for 6 months. It really depends and differs. Okay, between human. Okay, some people weaken all the muscles and cannot pick up the breath, the exercise tolerance within 6 months. Some people can. Okay, some people recover within 1 month. Yeah, it really depends. Okay, but basically those symptoms that commonly that we know are increase in temperature, cough, breathless. It may have some sinusitis, heart length, joint pains. Okay, joint pains normally what I commonly see in shoulder and neck, back, shoulders. Yeah, so all this, any parts of the body can be affected. All right, some even affect their balance. Okay, their balance, so they lost their balance easily. Yep. Okay, and these symptoms, whether it lasts how long, no one knows. Okay, so therefore that's where post-COVID rehab comes in, because we assess where you lost and we help you to pick it up again, pick up your function again.
Okay.
Yep.
Then there's a question. The symptom that you mentioned just now, is it similar or is it exactly the same as a long COVID syndrome that people mentioning? Or
yes.
Yes, so
But of course, if you
that's
are, when we mention long COVID, it doesn't mean that you have to always have a high fever lah. Okay, so the temperature may not be the part of the long COVID anymore, but who knows? Some days you may have some spike fever, some days you are normal. Yeah, that's also part of it.
okay. So just now you mentioned about breathlessness and all those things. So there's a question came in that is it require or any possibility of the patient after recovering still require the oxygen supply? Yeah, or is it
Okay.
just can independent from oxygen supply?
Yes. Okay. So what is the goal of discharging a patient? Okay. Of course, the goal the maximum optimum goal is to discharge the patient without oxygen. Okay. But from the X-ray, we know that this patient has so much of scarring in his lung or her lungs. All right. And we know with all these scars, this patient is not going to hit 95% saturation oxygen when discharged. But just now we say, if I discharge you at saturation oxygen 80%, okay, this is not right because you are not maximum yet. So now what doctors or what the medical team will do is that they will give you oxygen, 3 liter, 5 liter, all right, so that your oxygen level can build all the way up to 95, 98 with oxygen therapy. If that case, if you can reach that at 3 liter or 5 liter, they will discharge you. They will discharge you with the oxygen. All right, now if you need 25 liter of oxygen or 15 liter of the high flow mask oxygen to bring your oxygen to 95%, definitely they won't discharge you. Okay, so oxygen therapy for you able to discharge is more to the portable one. So in maximum is 5 liter only. So you can survive within the 5 liter or 3 liter per oxygen or 2 liter per oxygen, doctor will discharge you. So there are a few things that we want to look into. So we will see how bad your condition is. Yes. So that's where medical teams will discuss how I'm going to discharge this patient with oxygen, how many percent, what is a liter. Yes.
So in that sense, maybe recap a little bit. When they discharge, they not necessarily reach 95%, which because of some damage in the lung. So there's not necessarily.
They will discharge with the most optimum can be 95%. Yeah, but we make sure that during this 95%, they do not deteriorate or they do not fluctuate. Then it's fine. Okay, remember just now I mentioned there's a condition called COPD, chronic obstructive pulmonary disease. Now, this kind of patient, we also discharge them at 90% because we know no matter how we push, the lungs will only have 90%. Then fine. Because of this still needs some few days observation. I cannot say that, I push your oxygen to 5 liter today and you reach 92 now. Okay, discharge tomorrow. No, we will monitor. Okay, 5 liter, 92%. Tomorrow, the day after, it still continue 92%. All right, fine. Then we make a decision that yes, your maximum is 92%. Yeah. Also, there will be a way to investigate what is the maximum that you can go. So that's where they will make a decision that what is a baseline for yourself.
Okay. There's another question when they want to do a rehabilitation post-COVID, right? So is there any particular physio center can do it, or is it any particular specialist in a physio center or physiotherapist would able to do the this type of rehabilitations for COVID post-COVID?
Okay, honestly, this COVID comes in last year, 2020 and 2021. And everyone learned about COVID also these last 2 years only. And the most proud is medical team comes out with so much of research evidence, okay, to publish the papers about COVID within these last 2 years. All right, because why? We just try to educate and share what we know, okay, with all with everyone in the world. Okay, to tell that, okay, look, okay, I have these patients and I tried this method, it works. Okay, so that everyone can learn. So there's no specialist, so-called specialist for COVID. Okay, but it's just that there are some who is, for example, myself, okay, read more about COVID. So we call ourselves so-called specialists or a little bit more about COVID. Then we know how to handle you. Yeah, that's all. Okay. So now, of course, if you ask me, is there any physio centers that provide? It depends. Some physio center they do not provide, so you have to check with the centers individually. Yeah.
Okay,
so I think some hospitals do provide, some hospitals do not provide. Yeah, so it depends. Yes.
So basically, before they go in, they just call up to check whether the
Yes,
center do provide this
yes,
type of program for the post-COVID patient
correct,
for their
correct,
lung rehabilitations.
correct. Some physio center even provide some spirometer assessment to check how is your breathing, and what is your capacity, and then it come up with a report. Yeah, there is this kind of apparatus as well.
Okay. So there's another
Yep.
question, maybe the last one as the time is going to the end. So
Ah.
when they discharge and also from the hospital after post-COVID, then how often do they need to do the assessment to see whether there's any deterioration because of the scarring of the lungs and all those things? Oops. Wait now, I think our Ben has dropped out. Okay, so wait for a moment. There's some technical issue. Sorry, there's technical issue. Yeah,
Yep.
okay, you're back.
Yeah.
Okay. Yeah. So the question is, after they discharge from the hospital, so how often do they still need to go for the assessment? So, for example, there's a possibility of deterioration, or because of the scarring, the capacity go down, and what should they do, or how frequent the assessment need to be done?
Okay, actually those assessment that we mentioned, oxygen, spirometer, 6-minute walk, Bosch scale, right? Number one is a self-assess. You can do it anytime at home, anytime, any day. You can do it very frequent, 10 times a day to assess yourself. You can check your oximeter, check your oxygen, right? Every hour, every half an hour, no issue. Okay, so once you notice that, compared to yesterday is getting lower, compared to yesterday getting lower, compared to yesterday getting lower. Okay, yesterday I can walk 6 minutes, no breathless. Today I walk 6 minutes, a little bit breathless. The day after, even more breathless. You know already something has gone wrong. Okay, so yesterday I walked, this heartbeat is about maybe 130. Okay, after 6-minute walk. Today I walk 6 minutes, it is about 140. Okay, something like this. So all these changes give you a clue. That's why it's always good to document it. So therefore, in our this COVID rehab program, right, we will post to you, send to our clients, right, customers who sign up this package. We will send oximeter, Bosch scale, eliminated Bosch scale, Evoband, Spirometer. It's all in set. It's a COVID kit. And then we also send some papers for their documentation. So they can every day, every time they can write down what is the reading. So they can have their own jot down. So this is their data for themselves, if they are better or not. So if they find that my numbers compared to last time is kind of like dropping, something is not right already. That's why Malaysia, and anyway we are successfully to bring down the numbers of brought in dead. It's a very good, okay, because why brought in dead is with the cases that we miss them out, and they reduction in the oxygen in the body without knowing it. This is what we call hypoxia. Okay, when the oxygen drop in the body, you never know. You never have pick up in breathless. Okay, when you have breathless, the oxygen is only 70% left. Yeah, so you see, very dangerous. Yeah, so that's the thing lah.
Okay.
So therefore, any changes, if you think that it's deteriorating, you better get to reach hospital already.
Okay. So thank you very much, Ben, for sharing such wonderful information. And we also thank you Evo Performance for sponsoring the Evo bands. And just for your information, the World Spine Day Virtual Challenge still happening now until 16 October. And for those, we have some sponsor of Lucky Draw as well. So Evo Performance has sponsored some of the Evo band. So if you have participated and finished the challenge, then you are entitled for a lucky draw. Either we have a lot of lucky draw items, and Evoband is one of them, and Oxymeter also is one of them. So to win from the lucky draw. So thank you, Ben and Evo Performance for sponsoring the today's session. Just for your information, tomorrow we'll be having a workout session called 3D Maps. Your go to warm up workout routine will be happening at 6 p.m. on June. Remember to sign up. So on our Facebook page, if you want to look for the sign up link. Okay. So once again, thank you everyone. Stay safe and take care. Goodbye.